Good morning, everyone. Grab your coffee, settle into your morning commute, and get ready for a sip of insight to make your day a little easier and your Medicare knowledge a lot stronger. You're listening to Approved or Denied, Decoding Medicare, Medicaid, and Beyond for professionals, patients, and providers. Meet your host, Alaniz, RN, certified NLP practitioner, holistic dream life transformation coach, and founder of Just Brook LLC. She brings over 32 years of nursing experience, including 17 years in discharge planning and utilization review, with a proven record of 0 denials for an entire year in a full-service hospital. Her expertise spans traditional Medicare, Medicare Advantage, and Medicaid, along with hospital-wide utilization review from birth through hospice, SNF, rehab, long-term care, and home health evaluations, and MDS nursing for Medicare and private pay. She is also trained as a TILES nurse. Cami has opened and operated a home health agency as administrator, served as home health administrator, alternate administrator, director of nursing, and branch supervisor, and founded and ran a physician on-call service, serving sick doctors, for 3 years entirely on her own. Through this work, she has reduced ER visits, prevented unnecessary admissions, and increased patient satisfaction by directly coordinating care and aligning clinical, administrative, and reimbursement processes. This podcast combines her professional experience with the R3 Empowerment Method, giving listeners the tools to navigate Medicare, Medicaid, and life's challenges with confidence, clarity, and control. Let's get started and empower you to take charge of your healthcare journey. Meet Cami now.
Hi, I'm Cami Alaniz, host of Approved or Denied, Decoding Medicare, Medicaid, and Beyond for professionals, patients, and providers. I'm so happy you're with me today. So grab your coffee, and I hope you're having a great morning. So we were going to talk about Advantage plans and supplements today. However, my mom was in the hospital for 2 weeks straight and just recently got out a couple of days ago. So instead of talking about Advantage plans and supplements, we're going to talk about the importance of being a patient advocate. I'm going to share a little bit of my mom's stay with you so you can understand what we've been through and why it is so important that when you have someone in the hospital that you are there for them and you stay with them and make sure somebody's with them as much as possible the entire hospital stay. A few Thursdays ago, my mom woke up about 3:30 in the morning with a severe pain. She needed to take my dad for cataract surgery, so she dropped him off in the morning to have his surgery and said she was going to go to the emergency room and she was going to come back and pick him up. Well, instead, my mom got admitted to the hospital. I went to stay with my mom in the hospital when she was still in the emergency room, and my son went and got my dad at the eye surgery place and stayed with him while he had his eye surgery and took him home with him for several days. Anyway, so my mom went to the ER. She was told that she had gallbladder polyps, but that was not her problem. And she'd probably had them for a long period of time and they'd never caused her any problems. So not to worry about that. But she did have a small bowel obstruction. And she would be admitted to the hospital. 3 people tried to put in an NG tube a total of 5 times. That's a tube that goes up through your nose and down to your stomach to suck out like bile and different things from your stomach. And when you have a small bowel obstruction, the plan of care is generally the NG tube to suction and nothing by mouth or NPO for like 24 to 48 hours till they see how you're tolerating that. And then they'll start clear liquids. So that was going to be the plan. They made a surgical consult, or they placed a surgical consult, and they sent her up to a regular floor in the hospital. So when she gets there, we're waiting, like they're checking her in, and she knows the surgeon's supposed to see her. And she tells me I should go get something to eat because it's getting kind of late. And so I went to get something to eat. About 45 minutes or an hour later, when I came back, she had food in her room. She'd eaten a little bit of a sandwich and then some Jell-O. And within she was told that the doctor had written that she could eat until midnight, and then after midnight, NPO or nothing by mouth for surgery the next day. Within an hour of eating, she started having extreme pain to her stomach. She started thrashing around in bed. That continued for hours. Well, right when the pain had just barely started, they changed shifts. So she had a new nurse. And the new nurse was in there talking to us for a little bit. And my mom's pain was starting to increase. But the new nurse told us, she was busy. She had 4 or 5 other patients and she was just busy. And so I asked her if she wanted to look at my mom's medications, because by that time my son had picked them up and brought them up to the hospital. Because we were not planning for her to stay a day, much less 2 weeks. And the nurse told me she was just much too busy for that, and she needed to go see all these other patients. Well, my mom's pain continued to increase so bad that she was literally thrashing around in that bed for hours. I kept calling the nurse in, who kept telling me that she was busy with other people. Then she was going to call the doctor and get some orders, but she was busy. I did finally tell her, I'm a registered nurse, and if you would like, I'll call and get those orders for you if you're too busy. She assured me that she had called or would be calling. My mom could not have any pain medicine until 10:30 when it was due again. Well, let me tell you, even in Nursing 101, you learn that when your patient is in severe pain, yes, they may be one major pain medicine ordered, but you also either get that pain medicine increased if they're in severe pain, either the amount or the frequency increased, or you have something for breakthrough pain. You don't just let people sit around in pain for hours, thrashing around in bed because they're in such severe pain. And you do not tell your patients, oh, well, I'm sorry you're doing all of this back and forth, sitting up, laying down, kind of moving from side to side because you're in so much pain you can't sit still or lay still. But I am busy. I'm busy with my 4 or 5 other patients. Are you kidding me? Are you kidding me right now? Anyway, so she goes on, and at 10:30, she comes in with pain medicine like she had just deserved a gold star. Well, I got new pain medicine orders. Well, I told her, you know what? At this time, it doesn't even matter because she can have the old pain medicine because it's 10:30 at night, and this has taken hours. So she gives my mom the new pain medicine, and my mom gets really, really hot when she gets the medicine, and she moves the covers off, and then her legs go numb up from the bottom of her feet up to her middle of her calf or so. And she tells the nurse, and then she goes blind. And she tells the nurse that she's gone blind. The nurse does some neuro checks, and she does have right-sided weakness. My mom's vision comes back eventually, and the nurse stays in there for 40 minutes or an hour then because all these things going on with my mom. And she says that she's talking to the doctor and she's asking for orders, and she's telling us that she's typing in the computer system. So that was at 10:30 when she got the pain medication. At 10:38, my mom had this stroke, and we don't know it's a stroke yet. But while my mom's waiting for pain medicine and she's thrashing around in bed, all I can think is my mom is going to have a massive stroke because she's in so much pain, or she's going to die. My mom told me the same thing, that she thought she was going to die at that time and they weren't doing anything to help her. So 10:38, she has the legs go numb. She goes blind for a little bit. And we start to ask to talk to the hospitalist. At 1 o'clock, they take her for a CT, and at 2 o'clock, they wheel in a teleneurologist so that he can examine her over the computer screen or television screen. He wants to know why he wasn't called earlier because my mom definitely had a stroke. The nurse said because the hospitalist refused to call in orders. So the neurologist was furious because it could have been much worse, and he wasn't called for, from 10:38 till 2 o'clock in the morning is 3.5 hours. So he ordered Plavix and he ordered aspirin. The nurse told her that my mom couldn't swallow at the time because of the small bowel obstruction versus ileus. And so he told her to give it to her rectally. A couple hours later, she had a lab drawn at 3, and at 4 she had some x-rays. Around 3, we asked to talk to the house supervisor. First of all, I asked the nurse when she was going to get that Tylenol, and she said that she was waiting for the hospitalist to write the orders. I did question why, hearing the neurologist say that she needed the aspirin, why the nurse wouldn't write a telephone order. And anyway, she refused. And then, so she said she was waiting for the hospitalist to write the orders. I asked to talk to the house supervisor, who came in and assured us that all the problems my mom was having was our problem, that the nurse and the doctor are busy, and that's just the way it goes. Hello, we're in a hospital. My mom just had a stroke due to lousy care. The nurse tells us that she's too busy with her 4 to 5 patients, and the hospitalist hasn't called in orders for hours. That is not a problem of my mom. Like, my mom was having health issues. We're in the hospital. They're supposed to help people in the hospital. Come on. So he was completely useless. And then a few minutes later, the doctor comes in with a smirk on his face the whole time. I understand you want to talk to me. And I said, yes, we've been waiting to talk to you the last 8 hours. Well, I'm the only one here. And I said, it took you 2 hours to call in, or I'm here now. It took you 2 hours to call in pain medicine for my mom. My mom thrashed around in that bed for 2 hours or more, waiting for you to call in pain medicine. He said that he called it in as soon as he was called. So, number one, the nurse was lying and saying that she was trying to get a hold of the doctor. Or number 2, he was refusing to give orders like she said. Either way, there's a problem. And then it took you 3 hours to call anything in for the signs and symptoms of a stroke, and she's having a stroke. With his smile, he says, "You got your orders, didn't you?" And I said, well, it took you 3 hours. You're supposed to be here in the hospital. Why would it take you 3 hours to do that? All he could say was, "I'm within my time frame, and you got your orders, didn't you?" So, and then I said, you know what? I hope to God that you need the care that my mom needed and needs right now. And I hope that when you need it, that you get the same care that you give other people. I hope your parents need the same care, and I hope whoever you love all need the same exact care my mom needs. And I hope that all of y'all get the absolute crap care that you give. He smiled, because he kept that smile on his face the whole night, or the whole time he was in there, and said, in about 15 years, I'm going to bury my dad, and I'm going to bury him with or without a stroke, and it really won't matter. I cannot believe my mom had just had a stroke. This man refused to call in orders, and then he tells me when he buries his dad, it won't matter if he has a stroke or not. Like, my mom's stroke did not matter. What kind of crap doctor is he? I ask you. And then he tells me, well, if you need anything, just have them call me, and I'll call something in. I looked at the clock. It was 2:52 in the morning. I said, you know what? It is almost 3 o'clock. I seriously doubt if they call you on my mom, with the way you've called things in, that you're going to call anything in before your shift is over. He smiled and he said, yeah, you're right. That is the kind of pathetic doctor they have at this hospital. Pathetic. So at about 7 or 8 o'clock in the morning, they come in there and they're wheeling my mom out to go to surgery. I'm like, hold on. We haven't talked to a surgeon. We have no idea what kind of surgery she's going to have. We've not signed consent. And they tell me we ask, what kind of surgery is she going to have? Because my mom is still in extreme pain. She does not have an NG tube. She has a stroke now, and she has a small bowel obstruction, which, there again, every time someone came into the room, one person would say, oh, it's your gallbladder, it's causing all this problem. Another person would say it's an ileus. Another person would say it's a small bowel obstruction. None of them could get it straight. Regardless of that situation, they take her to surgery, and they don't even tell us what they're going to do. They say they'll explain it when they get down there. And so we all go down there with her. And the anesthesiologist, I hear her in the hall, and she said, but she just had a stroke. So the anesthesiologist comes in, two of the nurses come in, and the anesthesiologist tells my mom, I'm sorry, but I am not going to put you to sleep. You cannot have surgery today, at least not with me putting you to sleep, because you just had a stroke. And you can have very possibly have another stroke due to the anesthesia and the stress of surgery and all of that. I won't know until I bring you out of anesthesia if you have another stroke. And that one could be much worse. You could be paralyzed. Like right now, you can talk to us, you can move, you're not paralyzed. So, luckily so far the stroke hasn't been that severe. But you could have a very severe stroke if I put you to sleep right now. So no surgery today. So I asked, like, what are we going to do? Because her pain is intolerable. And they said, oh, it'll be very easy to control her pain. I was like, well, no, it's not with the crap care we've gotten. And they asked me, like, why? We're like the best hospital. Maybe there's certain, and I told them maybe your department is, but upstairs is not where she was at. And I told them about our night. They were horrified. So horrified that one of the nurses called the chief nursing officer, who ended up being off. So he got the chief nursing person in surgery to come talk to us, and the patient relations. He was going to call the president, but I guess the president was off. Anyway, so he's like, no, this care is bad. So anyway, so the chief nursing officer of surgery, and then that patient relations guy, I had gone out to talk to one of our friends on the phone about my mom's case what was going on with my mom at the time. And when I walked in, they were standing in my mom's room, and they said, I understand you want to talk to us. I said, yes, I do. So I went over everything that had happened that night. I did tell that patient relations guy, talking to you is like talking to HR. You're just going to look and see how much trouble the hospital may be in. You're going to tell me exactly what I want to hear, or you think that I want to hear. You're going to smile. You're going to sweep it under the rug and never do anything with it. He assured me that that's not the case, that if needed, the nurse and the doctor will be, they'll be reviewed. They'll review the case and they will get to the bottom of it. And if they need it, they'll be reprimanded. However, we will not ever know if they are or not. And then, so I tell him the story. He always had a very straight face and went and he just wouldn't let me know what he was thinking. But the nurse, not so much. He would smile and agree with me. And he was horrified with the care we got as well. I asked if I could see their policy on strokes. And the patient relations guy said, oh, no, absolutely not. The policies are only for us so that we'll know how to run the hospital. I said, well, let me tell you. I'm willing to bet TPA, which is what they give for strokes, should be given within 3 hours of the onset of a stroke, especially one that's in the hospital. That nursing officer or the nursing guy said yes, like smiled and said yes. And this is how our night went. And I explained all the things I've explained to y'all so far. And it is now 10:15 in the morning. This happened about 10:30 last night. It has been almost 12 hours. I can guarantee your policy does not say that TPA should be given within the first 12 hours, but within the first 3 hours. 12 hours is way too long. He agreed that it was. So the hospitalist never wrote the order for my mom to have that aspirin for the stroke. So they did get those things ordered at that time, 12 hours after the freaking stroke. And then speech therapy was in there. Nursing was doing neuro exams, and physical therapy came, occupational therapy came. They took her for an MRI. So then things got hopping. That patient relations guy was in there like 3 or 4 times. The last time he came just to give me his card in case I needed anything. Do you know that a few days later, my mom found out that, and the hospitalist was not ever supposed to see my mom again or be on her case. A few days later, my mom asked, because the nurse said, if we have any problems, we'll call the hospitalist. And my mom asked, who is it? And it was the same doctor. And they told my mom, we'll just call and get orders from the ER. The next night, we were told that that is not even a thing, that they cannot call the ER and get orders, and that hospitalist was on my mom's case the entire time. The patient relations guy said he would not be, and he was. I did see the patient relations guy in the cafeteria. He went and I was standing between the salad bar, just I'm between the salad bar and something in the little refrigerator thing. And there he came to the salad bar. I went and got whatever I needed. I checked out. I sat down to eat, enjoy my lunch. And he was coming to pay. He saw me. He put his salad down, went into a room, a conference room, came out talking on the phone. The guy at the cash register is like, your salad. And he just shook his hand as he walked by me real quick, like he didn't want it. And the guy was like, you don't even have to pay. Just come get it. You made it. Just come get it. He just took off walking, would not look at me, tried to avoid me. So what kind of care and researching do you think he did? I would say not very good. So my mom continued like this with the small bowel obstruction for a week. They would give her food and she would throw it up. And then they finally did, the sister, thank God, the sister got the NG tube in. She said God was on her side, which I completely agree. Some of the care, like from the sisters, was excellent. They were getting out. She threw up 1,000 mLs once. They were getting out like 1,400 mLs of bile out of her stomach. And then on that Thursday, the second Thursday she was there, the nurse tells us, oh, you're going to be clamped and you're going to stay clamped, and I'm not going to give you any pain medicine per orders, and we're going to give you something to eat. I said, let me tell you what we're not going to have. We're not going to have another flipping night like we had the other night. You will be calling the doctor. You will be getting orders. You will be treating my mom correctly. Or I'm going to take her out of here with the NG tube and the IV intact and take her to a different hospital where she can get some actual good care, because this is ridiculous. We will not be going through this again. So the girl got on the phone. She got the orders. I told her she needed to get. She immediately pulled out 45 milliliters of bile from that NG tube. That is 3 1/3 liters was stuck in my mom's stomach, and she was just going to follow orders and not listen to my mom and all the things that were going on with my mom. So that's the kind of week we had. My mom ended up having a small bowel resection. The next day, they took out 2 inches of her bowel, and she is recovering from that. Thank the Lord. She's not having major symptoms from the stroke, and we are expecting a full recovery from her small bowel obstruction and her stroke. So I do praise God for that. I do 100% believe that God was there. He reversed that stroke and all of that. But I am so passionate about people getting the right care. And when I am when I work as a case manager, if patients have problems, I do always try to talk to the right people to get those things resolved for them. But I am reaching out to you today because when you're a family member or those people closest to you are in the hospital, you have to be a good patient advocate for them, because these are the situations they face in the hospital. I'm a registered nurse, and I have been for 33 years almost. And my mom was getting crap care by some of the staff members. There's others like the sisters that were excellent, but all in all, she was getting crap care. Just about every single nurse up there, I would have to say, this and this is going on with my mom. Please call the doctor and get this and that order. And so basically, her care was coming from my suggestions. So your family does need you up there with them. You need to try to be there with them throughout their hospital stay, if at all possible. My mom dropped my dad off at cataract surgery that morning. She went to the emergency room thinking that they were going to just give her an IV, maybe take out a laparoscopic gallbladder, be gone the next day at the very most. She never anticipated a 2-week stay, a small bowel resection, and a stroke. So please, please be with your family members. If you need help, you don't know what to say, you don't know how to be that advocate, and we'll go over some of the things in our Helping People Like Me Ministries section in a little bit. But for right now, just know I am so passionate about this. You can email me at cami.approvedordenied@gmail.com, or you can contact me on my website, www.justbrook.net, justbrooke.net. And you can you can schedule an appointment with me. If you don't know what to do, I will help you. I can help you with case management issues. I can help you, like, kind of point you in the right direction if you need that for yourself or your family member. I will be glad to do that. And I'm so passionate about this. In fact, if there's any of y'all who need it or want it, I will set up a class on Wednesday evenings about 7 p.m. And it will be a small price to that, but I will set up a class so I can answer y'all's questions. I can help y'all move forward in getting the care you or your family member deserves. I do know rules and regulations. I've done all sorts of things in the medical field, so I know all levels of care, the rules and regulations for each level, and how to get you that help. I know the difference between supplements and advantage plans. I've had an extensive background with being in positions where I was the one doing the bill, like the MDSs and tiles, which that's how people get they bill for the services, doing evaluations, doing insurance authorizations. I had my insurance license for a while, so like I understand all these things, and I'll be glad to meet with y'all and try to be that, help y'all, teach y'all how to be that advocate for your loved one. So stay tuned. Next, we're going to go behind the scenes with Kristen. We'll answer some of the questions that providers and patients have in their day-to-day situations in the hospitals. This episode is brought to you by Helping People Like Me Ministries, a place where we empower you to remove blocks, reset, rediscover yourself, and live your dream life. Dive into my book, How Medicare Works, and Tools to Empower You with Medicare and Life. You can get that on my website at www.justbrooke.net for the ebook, or if you like the tabletop paperback version that you can take with you to appointments so you can point out exactly what you're talking to and have resources at your fingertips when you're talking to your medical staff, you can get that on Amazon. Also, dive into my Lifetime series, To Dream Life. This isn't a guide, it's my story. The challenges I faced, the resets I took, and the journey to realizing God was with me all along. It's real, it's relatable, and it's designed to inspire you to take control of your life. Grab your copy today at www.justbrooke.net or the paperback version on Amazon. Links are below. And start your journey today towards empowerment. Meet with Kristen. This is where Kristen will ask her questions, giving listeners insight, clarity, and actionable tools. This episode is sponsored by Helping People Like Me Holistic Wellness. Feeling exhausted, stressed, or running on empty? Your Isoline protein shakes give you 24 grams of high-quality protein, balanced macros, and essential vitamins from organic fruits and vegetables, all without artificial ingredients. Need clean, steady energy? BEA and E+ provide plant-based caffeine from green tea plus adaptogens to support focus, endurance, and mental clarity without the crash. And if you want to reset your body, the 30-day reset is clinically validated system that supports weight management, lean muscle, stress reduction, and natural detoxification. Fuel your body, boost your energy, feel like yourself again. Visit Helping People Like Me Holistic Wellness today. Hi, and welcome back to Approved or Denied. And we have Kristen Allred with us here today. We are so lucky. She's a nurse practitioner who has excellent patient care and really cares about not just making sure that their medical needs are met, but also their social needs. So we have a few questions for Kristen that are provider and patient related.
So this week at work, we had a patient and we were talking about options again coming up for discharge. So mom's coming home from the hospital and the kids are, I have to get back to work. We have our own kid that we have the patient's grandchildren to take care of. So family is very worried about mom coming home from the hospital and who takes care of mom. So even if we've looked at it and said, okay, these the skilled nursing facility is unfortunately not the option for us. We're coming home. What resources do we look for? How do we help them?
Well, if they have Medicaid and they have the correct level of Medicaid for providers, because there are many different levels of Medicaid, some only help with like the Part B premium. Some of them help with medications. Some of them help with providers and things like that. If they're at a level where they do have a provider, that provider would be there part of the day with the patient. If they do need 24-hour care, it'll be up to the family to provide that 24-hour care. You may have to have a meeting and just really like talk about a schedule and what family member can cover what times of the day. And if they're unable to do that, or if they have the resources available, they can hire one of the like a private company that has visiting like aides and nurses. You can reach those online. If you Google those, they'll be there. Also, if you have a friend or a family member in the community, that will probably be a lot more cost effective way of getting mom some help. And then home health, they can definitely have home health if she's bedbound. I mean, if she's homebound, she does not have to be bedbound. If she's homebound, they can have home health. But you have to remember, a lot of people think that when home health comes, they're going to be there for hours and they're going to do all these things. They're going to babysit mom. They're not. They're going to come. They're going to take their vital signs, their assessment, document. And if they document in the home, they may be there 30 minutes. And that's allowing her to talk as well for a little while and have some visitation. Someone to visit with. If they don't, if they just do the assessment and do their documentation later, they may be there like 10 or 15 minutes. So home health will not be providing that care. A traditional home health will not.
I see. And what exactly is homebound? What criteria, where's the line drawn in terms of homebound? Does that mean someone that they physically can't leave because they're in a wheelchair? Or does that mean they don't have transportation to go somewhere?
So it's not transportation, because all 13-year-olds would be homebound, wouldn't they? I'm sorry. I'm so sorry. Oh, there's so many patients that have said that over the years. I don't have a car. I don't have any way to get anywhere. But that does not make a person homebound. I wasn't trying to be smart aleck to you. But anyway, not having a car doesn't count, but being short of breath and having great difficulty, even if you have your own car to get into, can definitely make you homebound. If you can go to church and still be considered homebound, get your hair done, go to doctor's appointments. You can also, I didn't realize this for quite a while, but I had a patient who lived alone. He lived kind of like a few miles from town. It was not easy for him to get food. He really wasn't the safest for cooking and cleaning and doing all of that, but he could get in his car and go to town to eat. So he needed that nutritious meal every day. So at least the way I worked, he was still considered homebound because he had no other choice. So that's one of those gray areas. But anyone that can go get in their car and just go do whatever they want, go to the mall, go eat every meal and have like they're living it up, they're not homebound. Where this man, he was, he had some dementia. It was very hard for him to get around and get in the car.
Okay.
That was a completely different situation.
So we're talking more physical limitations than of the patient, not just transportation issues of the patient. Okay. What about oxygen? Where does that fall into the physical limitations of the patients?
Well, it depends on the patient as well. Some people have their little portable oxygen tank with them and they're able to go and do whatever they would like. Other patients, they are extremely short of breath and debilitated and they cannot get around. So it really depends on the person, like with anything. But the majority of patients who need oxygen are homebound because it takes so much energy just for them to even get around their house, take their shower, and do those things.
Okay. Well, then, so family agreed we'll take mom home, but mom also had a lot of episodes of incontinence at the hospital, needed a lot of help with her bathing. She now has a walker, and we're asking me about extra medical equipment. How would the family go about getting that equipment into the house? What type of avenues or what type of, who do we help direct them to for those?
There are DME companies in town that can provide that equipment for them. But shower chairs are not covered by Medicare. They are covered under Medicaid, but that requires a Title 19, and that's quite a lengthy thing to do when somebody's in the hospital. So their primary care doctor can help them with that. Rollators let me rephrase that. Rolling walkers are easy to get. Rollators are not as easy to get. So if you would like one of those spiffy ones with the chair and the handbrakes and all that, you probably want to just go ahead and go to Walmart and get one. Your primary care doctor may be able to get you one. But you have to remember, when people are in the hospital, the goal is to get them out as quickly as possible and when they're medically stable. So they're not going to be they don't have the time to be doing a lot of extra paperwork to get you like an electric wheelchair. Those things, the more hard to get items, the lift chairs that stand you up, those things have to go through your primary care doctor. The hospital can get you like a basic rolling walker. They can order a shower chair for you, but you're going to have to tell the company how you're going to pay for it. And they can also order a bedside commode for you. Now, if you're under Medicare, it's an 80-20 split, so they are not free items. You can also get them places like Walmart, CVS, Walgreens, or your local pharmacy in the area that you're in.
What about the hospital bed?
Hospital beds take some extra documentation. They seem to be a little bit easier to get now. For a while, they were almost impossible to get after COVID. And even like 6 or 8 months ago, I was trying to order one. And to find one that the insurance was going to pay for was impossible. My family ended up having to rent one themselves for their mom.
Oh, okay. Okay.
But the DME companies can let them know how long the wait is to get one of those. And they may have to go through a few DME companies to find one.
And are there any insurance policies or plans that help to cover supplies like Pampers or the wipes, all of the actual equipment that they were using at the hospital to help care for mom?
Yes. If somebody qualifies for Medicaid, that's where the incontinence supplies come in. Different equipment like blood pressure cuffs, things like that, that would be a private pay item. But the incontinence supplies, the pads that go on the bed, those are private pay, or you have to qualify for Medicaid.
Okay. And then I get asked this a lot by my female patients, especially after they've had surgery, they can't get up. Those Purewick devices, those suction devices for the urine, the external catheters, do any of the insurance policies cover those?
The last I checked, the only way you can get that is ordering it off of TV.
Okay. They sure are handy.
Yes, those patients do love those for sure.
Okay.
Always great to have you with us. And until next time, I hope that all your orders get approved.
Thank you, Cammie.
Kristen, thank you so much for those incredible questions. And thank you to everyone listening today. Remember, understanding insurance, whether it's Medicare, Medicaid, inpatient versus observation status, or who pays for the services you, your loved ones, or your patients need, is not just paperwork. It's the patient's health, finances, and peace of mind that we are responsible to protect. If you're a patient, family member, or provider and have questions like the ones we discussed today, email me your questions and they might be answered in a future episode of Approved or Denied podcast. Providers, hospital administrators, case managers, anyone in the healthcare field, including care coordinators, this podcast is your chance to be part of a platform that educates, empowers, and reaches thousands of patients and professionals. We have sponsorship and collaboration opportunities that align your organization with trusted, actionable guidance in Medicare and Medicaid spaces. Message me for details on how you can participate. My email address is Cammie, Kami, .approvedordenied@gmail.com. Now stick around because we have 2 more segments coming up. We're diving into getting you even more clarity and tools to navigate the healthcare system and your life with confidence. Don't forget to like, share, and subscribe so this important information reaches as many people as possible. Let's help patients, families, and providers get the clarity they deserve. Let's try to have 1 million viewers. Thank you, and I'll see you in the next segment. This segment is brought to you by Helping People Like Me Holistic Wellness, evidence-based nutritional systems for real-life performance. Isoline Protein Shake provides 24 grams of high-quality protein, balanced macros, and vitamins from organic fruits and vegetables. The 30-Day Reset is a clinically validated program supporting weight management, lean muscle, stress reduction, and detoxification through structured intermittent fasting. Recharge and Add supports cellular energy production and protection using advanced capsule technology for optimal absorption. Whole body wellness solutions for healthcare professionals, patients, and anyone ready to feel stronger and perform at their best. Visit Helping People Like Me Holistic Wellness today. Remember, if this podcast helps you, tips are always appreciated. And if you want to apply to be a sponsor or guest on the show, email me at cami.approvedordenied@gmail.net with your company name, why you would be a great fit, your phone number, a couple of available times to discuss the possibility. We love connecting with sponsors who want to help empower people. Thank you. And welcome to the Helping People Like Me Ministries segment. So, today we're going to talk about being an advocate and why it is so important. You know, when you're the patient or you're the loved one, it is a very, very stressful time. And we're going to talk about some tips on how to be a good advocate and keep everybody on the same page, some ways to avoid some pitfalls. Later in a different episode, we'll talk about reducing stress, increasing self-love, increasing that bond, and different things like that. But if your loved one goes into the facility, even if you're having a time when you are not getting along, this is not the time to let that get in the way. They need you so much, and for no other reasons. We don't want you to feel guilt later. We don't want there to be a situation where there's a problem with forgiveness. So it's a time to just let bygones be bygones if that happens to be your situation. And we'll talk about how to remove the problems in the future. But in that moment, you need to kind of let it go if at all possible. So some important things to have when you or your loved one admits to the hospital is a notebook. Keep a list of your questions in that notebook. If you have a medical experience, it may be a little bit easier for you. But even somebody without medical experience can definitely have a notebook. Keep a list of questions. Also, keep a list of the diagnosis. Like I just told you, my mom, they said she had something wrong with her gallbladder. She had an ileus. She had a small bowel obstruction. And so it was very confusing as to why they couldn't get their diagnosis together, why everybody that walked in that room said something different. So that is keep a list, so that way you can ask the hospitalist who should be in charge of the care what exactly is going on if you get conflicting stories. Or you can ask, like in our situation, the surgeon did a lot of good for my mom, and he was kind of one to ask questions too. And then also write down the plan of care, what they plan to do, when they plan to do it. If your loved one is supposed to be nothing by mouth, like my mom, also called NPO, then if they bring a tray in, you need to let them know she's NPO and to take the tray away. Or if they're supposed to start clear liquids or they're supposed to have a regular diet and they haven't, then go to the nurse's station and ask about it. If you go to the nurse's station, they're probably going to tell you to push the call light. But you know who gets the most help? The person who pushes the call light and goes to the nurse's station. In our situation, I would just help my mom with what she needed. And sometimes we would push the call light, like when she needed pain medicine or something I couldn't help her with. And sometimes it took more than one time, but the squeaky wheel gets the oil. So remember that. If you can't do it yourself, then be consistent with pushing the call light. Or if someone comes in, asking them to notify the nurse or the aide or whoever you need the help from to come in. If you're still not getting help, report it to the doctor. Go to the nurse's station. Ask to talk to the manager of the floor. I've seen so many staff members. I don't know. I don't like when I went to nursing school, man, you better like have your stuff together. You better know what you're talking about. And, there were certain things you just had to do. Nurses didn't just sit around the nurse's station and talk about this, that, and watch movies and stuff like that. But I do see that from time to time. And so that is not only not good for the patient, but, like, why isn't management taking care of that? So be on the lookout for those things. And if you're at the nurse's station a lot, you're probably going to get better care because they're going to cut down on the messing around if they're doing it. Some nurses are excellent and they don't do it. They are very patient driven. If they're busy, they actually are busy. So it's going to depend on the personality of whoever's taking care of you. Stay with your loved one as much as possible, but that notebook, writing down the names of who is working on your loved one's case, their position, the time of the visit, what they say, keeping a running notebook like that will also help. That way, if you're not there, you can write down whatever questions you and your loved one have come up with, so your loved one can ask and fill in, whatever the answers might be. Staying as much as possible is important. You can leave a message and ask that the doctor or whoever that you're waiting for, whoever you need to talk to, you can leave a message and ask that they call you back. But, this is a business and they are at work. So this is, like when we're the patient or we're the family member, then we have a completely different mindset than most of the staff. So you can ask for them to give you a call if you absolutely cannot be there. But the fact is, they do have a lot of patients to see, and you might not get that call. Just like when you're at work and you may call a number and they don't answer, or you may call and it's the wrong number and things like that. That happens for the medical staff as well. So the more you're there, the better your questions will be answered. If it's completely impossible, then you need to have your loved one cell phone with your number in there so they can call as soon as the doctor or staff member walks in that you need to speak with. At that hospital that I was telling you about that my mom was in, my mom was like, you do travel case management. Can't you just work here? We want you closer. We need you closer. I'm in the hospital. Can you just please go down and talk to them about a case management position? So I went down, I talked to some girls that were in the office at the time. I'm like, I'm Cami Alaniz. I'm a case manager. I do traveling, but I probably need to be here now. So I just wanted to stop by and see if y'all need a case manager. They said they do. So I interviewed with the people that were in the office, and they were like super excited. One of them had even worked with me in the past. She worked for the rehab at the time, so she would send me weekly updates on the patients, and then I would, either authorize them to stay a few more days or, help make the plans for them to go home by ordering home health or whatever they needed. And they said, so a couple of days later, I met with their manager, and their manager said, sorry, my computer is going dead. Their manager met with me and asked, was I a patient advocate, basically? And I mentioned, yeah, I am a patient advocate. My brother was born with a congenital heart defect. So, if somebody's planning to go home and it's unsafe, and especially if they live alone, and they need that little extra care by going to a skilled nursing facility first to get some therapy, then they can be stronger. They, less likely to fall and have that little extra care for a few days. Then I'm going to suggest that, not to try to make the length of stay longer, but patient safety is important and the correct discharge plan is important. She let me know that they have their policy policy for case management is a 1-day stay, 1.1, 1.2, 1.4 at the very most. People do not ever go to rehab from their hospital. The therapists write orders that say in a facility. They don't ever write rehab, and they never write rehab orders because it takes so long to go to rehab. And then she asked me, who is your mom? So I told her, and she looked it up, and she said, oh, yeah, what is her discharge plan? I said, well, she plans to go home. She said, really? You think she's going to go home? And do you think that's a good plan for her? And I said, well, that's what she would like to do. If not, she's going to go to rehab. But don't worry, she has Medicare with a supplement. So it's not going to increase her length of stay. I cannot believe it. I had to defend my mom's length of stay. My mom, who had had a stroke in that hospital from what I very much believe was the poor care, and the house supervisors told me, oh, it's not from our care. And I understand, because I'm not dumb. I understand that there's cholesterol that builds up over time. I understand that strokes are caused when a little piece of cholesterol breaks off, or a little piece of fat, or a little blood clot breaks off, and it goes to an area and it constricts the blood flow, and that's what causes heart attacks and strokes. Or it could be constriction from high blood pressure, or it could be an aneurysm or an area that bleeds. I understand that, but to tell me that they were nowhere responsible, that means that every single doctor and every single commercial that comes on TV that says avoid stress to help reduce the chances of having a stroke or a heart attack are lying. Do you think everyone in this world is lying or not? I mean, seriously, obviously those things can trigger a heart attack or a stroke, or they wouldn't say it on TV and when you go to the doctor. Anyway, so you have to be very careful with which hospital you go to. So this hospital would only allow a 1.4-day stay. I had to defend my mom's length of stay after having a heart attack from very, very poor care and having a bowel resection. Still had to defend her plan of care. I had to defend her discharge plan. And that is not a place you want to be a patient. It's not a good place for my mom to have been a patient. So look around your community and find out, if you can, what their case management policies are on discharge. That lady told me that people come in and they can have their lab drawn and their x-rays done, and then they can go home and wait for the results. They don't need to wait there in the hospital. That is not even a thing with a lot of patients. That just means that they have an emergency room, and a lot of people need more than an emergency room. My mom needed much more than a 1-day length of stay, at the very most a 1.4 day length of stay. And she was so proud of the fact that her hospital is so compliant with that. A friend of mine's dad was in the hospital for 29 days. Do you think he could have lived with a 1-day length of stay? No, he couldn't. So you need to look at the hospitals that you're going to. You need to make sure your insurance is approved there, or they're contracted with your insurance, because if you have an HMO or a plan like that, you don't want to go to a hospital where they're not contracted, because your bill will not get paid unless it's an extreme emergency. And then you also, if it gets around that there's a really bad hospitalist, then don't go there until you find out that person no longer works there. And like in my mom's case, she had that bad hospitalist for all those days, and thinking that that he was off her case, but he wasn't. So, and them telling you, oh, they'll look and see what's going on. All those days later, that nurse and that doctor were still there. So nothing was happening in my mom's case. If you're nervous about helping your person get the care that they need because you are not experienced with the medical field, this is called an NLP tree. And this is something you can use for this or anything really to set a goal. So if your goal is, we'll just say, be courageous or courage, you put your goal in this top line in this bubble right here, and then here you list your assets, and here you list the things that hold you back. If you've never done it before, lack of experience would go here. And but then think of, for your assets, think of other times you were scared to do something or you didn't know quite what to say, but you successfully pulled it off. And add things like that here. Your loved one, you want them to have the best care, and you are the number one person to be their advocate. So write those kind of things here. You can write, you're going to make a list, you're going to learn this, you've learned many other things. Think about when you went to school and you started to learn to read. That was hard. So you just make all the list of all the things you've accomplished in your life that you were scared to do or didn't have the confidence to do. And here you can write down the things that are holding you back, and to make this, but turn this negative list into positive. Just think of times when you've had that same fear before, but you're able to figure it out and make it a positive, and your confidence will grow, and your loved one will get the care that they need. And you need to keep an eye on them. There's many people that give wonderful care. If you need more assistance, please visit my webpage at www.justbrook.net, JUSTBROOKE.net. There you will find 60-day courses for those of you who want to take a deep dive and have daily audios sent to your inbox, where we'll have inspirational speaking plus small tasks to do to help you reset and rediscover yourself. We have medical management, we have professionals, Girl Time, Girl Talk, just for guys, and for medical staff and people with medical problems. That includes caregivers. You get daily audios and videos for 60 days. We have worksheets that go with them. We have weekly chats where I help answer your questions if you have questions, or we just have a weekly hot topic. Those are great for people who really are ready to make a big change in their life. A little bit more budget friendly are the bundles. Those are anywhere from 3 days to 30 days. You can do Reset, then Rediscover Yourself, and then the Dream Life series that way as well, or bundles that way as well. And that will last you 3 months. You can get those with or without worksheets and every other week group meetings, and they're great to help people in situations reset and rediscover themselves on a little more budget friendly manner. We also have ebooks, I have coaching, and I have classes. And classes can, once I get a few people signed up for classes, then we can decide on dates that work for people. Anyway, I look so forward to helping you. You do not have to be on this journey alone. My ebooks include how Medicare works and tools to empower you with Medicare and with life. So all of my books have a section that have like some different tools you can use to help yourself reset and rediscover yourself. No matter what the topic is, they all include some tools. I have adjustment to assisted living and nursing home. I also have like my Lifetime series to Dream Life, to let you know it's more of a memoir of my life, the ups and downs, to let you know I understand you, and anything that's going on in your life, I've probably been through it, and I am here to help you. I have the key to happiness, the key to success, and many more. Please visit my webpage, www.justbrook.net. Thank you for joining me on this episode of Approved or Denied, Decoding Medicare, Medicaid, and Beyond for professionals, patients, and providers. Don't forget to check out my ebooks on my website, www.justbrook.net, JUSTBROOKE.net, or my tabletop paperback on Amazon. and join the ministry to continue learning, growing, and living your dream life. Tip generously if these episodes help you, and stay tuned for our next episode where we dive deeper into Medicare, Medicare Advantage plans and supplements, networks, and trade-offs. I'm Cami Alaniz, reminding you that you can remove blocks, reset, rediscover yourself, and live your dream life. Until next time, may God bless you and may God bless America. Bye-bye.
Thank you for joining us today on Approved or Denied, Decoding Medicare, Medicaid, and Beyond for professionals, patients, and providers. Remember, you can explore Cami's books, courses, bundles, and classes at www.justbroke.net to empower your Medicare knowledge and life. These resources are designed to help you remove blocks, reset, rediscover yourself, and take control of your healthcare and personal journey. If this episode helped you, tips are always appreciated. And stay tuned for our next episode, where we dive deeper into Medicare Advantage plans, supplements, networks, trade-offs, and behind-the-scenes information. Cami Alaniz reminds you that with the right tools, guidance, and faith, you can navigate life and healthcare with confidence, clarity, and empowerment. May God bless you. God bless the USA. Until next time.